The current humanitarian crisis in Bangladesh is overwhelming. The Rohingya have been fleeing from Myanmar for years in an attempt to escape from severe violence and persecution. Currently, there are over 1 million refugees living inside camps in Cox's Bazar in Bangladesh, where many NGOs and humanitarian groups have been struggling to serve these Rohingya refugees who are dependent on aid. I had the opportunity to volunteer with a group called Med Global this fall, and the following presentation highlights some of the work that was done, what is needed, and what you can do to help. In September 2018, I completed a 2-week mission as a volunteer nurse with Med Global. During my stay, I worked with an incredible team of coordinators, local Bengali staff, and international volunteer medical professionals. Med Global relies heavily on volunteers and donations from the public in order to serve both the Rohingya and Bengali patient populations. During my 2 weeks there, I saw many pediatric patients coming in with various complaints such as asthma, fever, cough, ringworm, as well as the elderly who needed medical attention. Heroic efforts are being made by local Bengali NGOs as well as international NGOs. However, the volume of people who are in need of services far exceeds what is currently available. There are approximately 1.3 to 1.5 million people in need of services. This is inclusive of the Rohingya, in addition to underserved populations of Bengali people. Within the refugee camps inside Cox's Bazar, there's one hospital for every 116,700 people, one primary health facility for every 39,393 people, and an estimated number of needed consultations per year is almost 4 million. As much as healthcare and NGO workers inside the camps would like to provide appropriate services for the Rohingya and Bengali patients, this does not always occur due to a lack of funding. In the top left photo, you can see an elderly woman being carried by two men, who are holding up a bamboo stick to get her from one place to another. This is typically done on a daily basis when services such as ambulances are not available to properly transport sick patients to other facilities. From my volunteer experience, I have seen the Med Global team provide quality care to its patients. This NGO has been on the ground in Cox's Bazar for over a year, and each week new physicians and nurses, as well as other healthcare workers, come in as volunteers to add extra manpower to the team. One of the highlights of my volunteer experience was definitely working with the local Bengali staff, from drivers to translators. They have a huge role in these camps as they are our eyes and ears. They help us understand what the patients are feeling, and they're also just a pleasure to work with. All the volunteers are able to connect with these young men, and many of them are very bright, some of them with degrees in engineering. One was in law school. There's much that they can teach us when volunteers are on the ground interacting with them. A beautiful aspect of what Med Global is doing is creating jobs and employing locals, such as doctors, pharmacists, paramedics, and triage personnel. The field coordinator and clinical coordinator on the ground have this mentality of mentoring local healthcare leadership in order to develop them as people, as leaders, and to build sustainability so that hopefully in the near future, if the crisis dissolves, there will be continued expertise on the ground to facilitate this work that's being done. As a healthcare leader in the United States, I have much experience seeing the effects of not having enough funding or resources to run a hospital. In Bangladesh, Med Global is currently operating at 40% capacity due to lack of funding. They have potential to see 40 to 50% more patients per day, which for this refugee camp, it's huge. There are ways for the group to improve quality of care and to provide services such as ambulances, which currently there is no designated vehicle on site. So the reason for my involvement now, post volunteer, post mission, is to talk about my experience so I can spread awareness and hopefully generate interest in terms of people signing up to go over there and help out and see the situation for themselves, as well as get some donations in, get some money over to Cox's Bazar so that these groups of hardworking NGO workers can continue to provide care for the Rohingya and Bengali patients. Thank you for your time. Please take a moment to share this information with any friends, coworkers, loved ones, family that you have. It's very important for us to bring light upon the issues that are going on in Cox's Bazar. And I strongly encourage you to donate through this GoFundMe link. 100% of the proceeds go to Med Global, and the amounts raised will certainly help this NGO take care of patients on the ground in Cox's Bazar. Thank you.